Yeah, my name is Dr. Girdhar Gyani. I am currently Director General, Association of Healthcare Providers India. Now, this HPI, what we call is a pan-India association of the majority of the hospitals in India. Our main role is to do advocacy with the government and regulatory body on all the issues which actually bothers our healthcare industry. Our aim is to see that well-being of the citizens of the country is taken care of by our member hospitals. For that, we also enable our hospitals through training and counseling in the area of patient safety, quality, affordability, technology, and other allied matters. HPI is in existence since October 2012. That means it has been more than 5 years now we are in the existence. And we have 14 chapters in the entire country covering all the states of the country, and each chapter has a separate executive body which functions on the matters related to the concerned state, but overall policies are dictated by the central HPI, which has got the governing body, where I am the chief executive for the entire HPI. Actually, I am personally associated with the Double Helical for past 3 years, and during this period, I have been the member of the jury consecutively for two occasions. And aim here is to recognize, identify, and give awards to the uh, the doctors and the healthcare professionals for the distinguished service which they have been rendering in the healthcare services to the community at large. I must say here that the process followed by Double Helical magazine is very transparent. They do not interfere in the work of jury, and all the jury members are very senior healthcare executives, and this has really opened up the gates for identifying and recognizing the people. Sometimes those people also who are actually hidden, in the sense they work behind the scene, and many times they are not in the limelight. The criteria selected by Double Helical is basically to really identify those people whose work has made immense impact and difference to improve the healthcare scenario in the country. So I really compliment the magazine, the officers, staff working in this venture, and we wish them well. And whatever we can contribute in the time to come, we'll keep on contributing. So this is the Double Helical. I must also say here that I am known more in this country and even otherwise in the area of healthcare quality. As I must say here that I have been instrumental in establishing National Accreditation Board for Hospitals and Healthcare Providers in year 2005 and 6. In fact, this accreditation framework has done immense impact on the healthcare scenario of our country. Before 2005 and 6, we did not have any criteria or framework by which healthcare quality was identified. In fact, I must say here that healthcare quality is synonymous with the patient safety. In considering that in 2013 there was a study carried out by Harvard which says that 5.2 million medical errors occur in India annually. That is a point of serious concern, and this is what happens when we do not have any established criteria for evaluating the patient safety in the hospitals. These largely come because of the hospital acquired infection and the medication errors which happen without the knowledge of the doctors. Now, this criteria was designed by me and by my team of doctors, by which this criteria was later on globally recognized and accredited by International Society for Quality in Healthcare. And I must tell you here that today we have got around 600 hospitals which are accredited by NABH, for which I was the founder, CEO. And these 600 hospitals, that means, have the global recognition in terms of patient safety and quality. And this is the reason there has been manifold increase in the influx of international patients coming to India. So, and now we have also started a program, what we call entry level certificate under NABH, so that we want to cover large number of smaller hospitals. And I am happy to say here that more than 570 hospitals also have got entry level certificate. So all in all, we have also tried to link this NABH accreditation and certification with the insurance company, including the private insurance company and the government-sponsored health insurance scheme like CGHS, ECHS, ESI, by which these schemes provide incentives to those hospitals which have got NABH accreditation through additional reimbursement ranging from 15% to 25%. So all this is driving quality and patient safety in our country. So this has been the one of the achievements which I will always remember throughout my life, and by which we have been able to establish the and define the framework for quality and patient safety in our country. Mainly, actually, this criteria is also helping the doctors, nurses, allied healthcare professional in the hospitals to be conscious about what they do in the hospital to improve the patient safety. And there are now standard not only for hospitals but also for the radiology centers, blood banks, Ayush hospitals, and clinics. So soon I can see now in next 5 to 10 years time, majority of the healthcare providers will be having either NABH accreditation or NABH certification. Let me also add here that the Ayushman Bharat, which has been launched by Government of India, and hopefully it will be rolled out from 15th of August, it has got built-in criteria by which any hospital which is having NABH entry level certificate will be given 10% additional reimbursement, and which has got full NABH accreditation will be given 15% additional reimbursement. So, considering that Ayushman Bharat is aiming to target around 20,000 hospitals, all these 20,000 hospitals in time to come will aim to get NABH certificate or accreditation. So that will be tremendous boost to the patient safety environment in our country, and the medical errors which keep on happening, as I said earlier, by Harvard study, will drastically come down, and that will have impact on the longevity, morbidity, mortality areas in our country. So I think these are some of the contribution which where I have been associated, and I feel immensely satisfied that I have been part of this great initiative.